If you didn't know already, IIH stands for idiopathic intracranial hypertension. What does that mean? So idiopathic means we don't know the cause of the problem. Intracranial means in the skull, and hypertension means too much pressure. IIH is a diagnosis that you may receive from a doctor if you're experiencing high pressure inside of your head, but there's no underlying condition that they've already identified to explain those symptoms. Symptoms include headaches, tinnitus, temporary blindness, double vision, blind spots, neck and shoulder pain, and peripheral or side vision loss. Risk factors include being a woman between the ages of 20 and 50 and being overweight or having a BMI greater than 30. Because IIH is idiopathic, there is no cause for it, no identifiable cause, but there are other types of intracranial hypertension that do have known causes. Acute intracranial hypertension happens suddenly because of an accident or a stroke, and chronic intracranial hypertension develops over time because of a health problem like a blood clot or a tumor. This is where I went from being an IIH suspected patient to being a chronic intracranial hypertension patient because of my Chiari. The tests that they would do are a physical exam, brain imaging like a CT or an MRI scan, and a spinal tap, of which I had all of those. Your doctor may also check your peripheral vision during a visual field test and do a dilated eye exam to look at your optic nerve. Treatment includes weight loss of 5 to 10% of your body weight, medicines like Diamox, and surgery to reduce the pressure. I include the tag IIH on my Chiari videos because I was originally thought to have IIH rather than my Chiari being symptomatic, which is very frustrating because we already knew that I had low-lying cerebellum, but we'd also done a spinal tap and found that I had high pressure in my dura. So the diagnosis process can be very frustrating and very long. There are myths about the degrees of Chiari and whether or not they are symptomatic. They're often noted as being an incidental finding and not something that a doctor will necessarily say, aha, this explains everything. So I put that out there because people may be at a different point in their health journey and in their diagnosis journey, and they may not yet be looking under the hashtag Chiari, but may be experiencing the symptoms. I hope that helps explain why I would include IIH under one of my Chiari videos.